Wow, drinking alcohol or not, when my mom was pregnant with us, she was told to have a drink to calm her nerves, but then we learned that the alcohol wasn't good for pregnant women, and now we're hearing some more news about alcohol. So, what have we learned? Take us away.
So the title of our webinar is To Drink or Not to Drink. Now, to Dr. Curnew, to ourselves here from the clinic, this seems like a pretty simple answer. But maybe to some of you watching, this might be a question that you have to think about. So while you watch this presentation and learn a little bit more about the risks of drinking alcohol, we want you to be able to answer this question confidently by the end and know what answer it really is.
So a study that looked at a mean of 694,660 deaths in the United States between 2015 and 2019 found that an estimated 1 in 8 deaths among adults who are aged 20 to 64 years were attributable to excessive alcohol use, which is quite a lot.
And alcohol abuse actually kills over 3 million people a year globally. And that's an incredibly large number for a preventable cause.
And also, approximately 15% of Canadians who drink alcohol consume above Canada's low-risk alcohol drinking guidelines.
And that was based on older data. This is not based on the newest data. So we're going to show you that, the new and the old.
So these are just a few statistics about global and national alcohol consumption and abuse. Now, do you want to be a part of this statistic? We think not.
So now, just to check up on what is a standard drink, you can see here that in Canada, a standard drink is equal to 17.05 milliliters, which is also 13.45 grams, and that is of pure alcohol. And just to give you a kind of standardized way to compare this to actual bottles, that is equivalent to a bottle of beer of like 12 ounces, 341 milliliters, and that's 5% alcohol, or a bottle of cider, as well as a glass of wine or a shot glass of spirits. So all of these are what is considered a standard drink in Canada.
So at one time, red wine was considered a health food, and that beer and spirits may be different, but we learned it's the alcohol content that's important. And so one of the myths is red wine or a bottle of beer or cider or just a shot of alcohol all carries the same risk. Go ahead, tell us more.
So we just want to talk a little bit about binge drinking. So binge drinking is a pattern of drinking alcohol that brings the blood alcohol concentration to about 0.08% or 0.08 grams of alcohol per deciliter. So, this looks like about 5 or more drinks per session or per in a setting for men, or 4 or more drinks for a woman. But like Dr. Curnew said before, these guidelines are really outdated. And binge drinking, while it might seem like 4 drinks might not seem like a lot to you, it is quite a lot, especially in 2 hours. And binge drinking is one way, but also drinking 1 drink is just as much as binge drinking. We're going to get into a little bit about that too, about just how harmful 1 drink of alcohol can be, because binge drinking doesn't give the whole picture.
So now we'll be going over some misleading and outdated guidelines. So these are the old ones that do not or should not really apply anymore. So if you simply search up some guidelines online or take a look at the current Health Canada guidelines, these are what you will see. So they say to limit alcohol to no more than, for women, first of all, 0 to 2 standard drinks per day, or 10 standard drinks per week, and 3 standard drinks on special occasions. Whereas for men, they recommend 0 to 3 standard drinks per day, 15 standard drinks per week, and 4 standard drinks on special occasions. However, it's important to note that these guidelines are incredibly outdated, and they were created and last updated by the Canadian Centre on Substance Use and Addiction in 2011. So that's more than 10 years ago. And you can see that these have changed a lot by now. And we'll be taking a look at how it has changed.
So we're saying that currently 15% of Canadians drink greater than these amounts. Okay, tell us more.
So this is exactly what this slide should actually look like, a big X. This is completely wrong. In the future, if you ever do search up these guidelines online, you'll find the same thing, same outdated guidelines on the Government of Canada and Government of Ontario's published pages. And this is completely wrong. So in the future, do not take these guidelines into account. It's time to look at some more recent research.
So now looking at the new guidelines to alcohol consumption, this year the CCSA actually updated those guidelines after spending 2 years researching and reviewing some peer-reviewed studies, and this is what they came up with now. So the new guideline is a maximum of 2 drinks per week, and this amount though is still in many ways quite unnecessary and preventable because it can still lead to health complications. So we'll be taking a look at what complications this can still lead to.
So this is the Canadian Centre of Substance Use and Addiction. This just came out in the last month or so, based on the largest data set of looking at total alcohol consumption, alcohol across the world. So it was re-looked at. And this is actually much different than what you heard from before. It used to say, 10 drinks a week for females and 15 drinks a week for males. And, when I start medical practices, have a glass of red wine or 2 or 3. It boosts your HDL cholesterol, the French paradox. People had less heart disease in France. But, science evolves and things have changed right now. So this number of 2 drinks per week is 0 to 2. 0 is better, but, none of us are perfect, especially myself. And but this is something that it really, people are having trouble accepting this. And this is actually based on good science. Tell us more.
So the consequences of drinking include several health risks. And every drink you consume, they really do increase the risk of developing cancer, heart diseases, and having stroke. So we just wanted to mention again that these guidelines are a limit, just as Dr. Curnew said, but they're not a goal. If you can drink less than 2 drinks a week, that's even better. That's the best. So, while they might be a limit, there's science to back up that 0 is the best. So we're going to move on to some associated risks.
So now just looking at some consequences of drinking multiple times a week, this can include a lot of health risks. With every drink that you consume, they increase. So these include risks of developing cancers, heart diseases, and having a stroke. And so when you drink about 3 to 6 drinks a week, you will notice that there is an increased risk of developing cancers like breast and colon cancer. And if you drink 7+ drinks a week, you have a higher risk of developing heart disease or having a stroke. And then every time you drink more, that risk just rises higher and higher.
So moving on to some general statistics about drinking. In 2014, I believe, the WHO found that alcohol misuse was the first leading risk factor for premature death and disability amongst individuals between the ages of 15 and 49. And in 2019, the WHO found that alcohol contributed to more than 200 health conditions related to injuries and diseases. So these include road injuries, liver disease, cardiovascular disease, suicides, and tuberculosis. So overall, alcohol promotes risky behaviors and worsens multiple health aspects, as we'll explore further now.
Yep, and also in 2016, the distributions of deaths that were attributable to alcohol consumption were investigated, and basically the results found that 28.7% of deaths were due to injuries, which are associated with risky behaviors when upon alcohol consumption, such as drunk driving or violence, and 21.3% were due to digestive diseases, including liver or pancreatic cirrhosis, and 19% were because of cardiovascular related diseases, 12.9% were because of infectious diseases like tuberculosis or pneumonia, and lastly, 12.6% were attributable to cancers, and those were typically of the upper aerodigestive tract. So now we'll investigate how alcohol affects each of these possibilities in more detail.
What's kind of interesting, as you point out, we all knew about that, that people who drank too much, car accidents, drinking and driving, and then alcohol is part of our goes through our gastrointestinal tract, so you can see anywhere from ulcers to then everybody heard about their cirrhosis. But one of the new things is that cardiovascular disease, there's a thought that heart disease is prevented by alcohol. It's not, it's actually increased. And you're going to show something indeed on atrial fibrillation, which is the most common rhythm, that's not the case. And I think less apparent to many people is that, alcohol weakens the immune system. We're now, battling infectious disease right now. You mentioned tuberculosis. Now we have issues about COVID, and during COVID, alcohol consumption has gone up by a third across Canada, and we now know that alcohol is a type 1 carcinogen, so same category as cyanide and tobacco. So this is something that we all have to, think about, is that the things that we thought we knew, we have to adapt and learn. So thanks for sharing that. Tell us more.
So now we're going to talk a little bit about some alcohol versus sex differences. So although there's a higher prevalence for alcoholism amongst men, that's what the studies show, that more men are at risk for alcoholism. Women are actually more prone to developing or suffering from bodily damage to their brain, their heart and liver and other organs following binge drinking or alcohol abuse. So there's a variety of social, environmental, physiological and genetic factors that contribute to the sex differences in response to alcohol intake. And these differences are mainly influenced by various neurotransmitters and growth factors, including dopamine.
Yeah, so overall, it's been found that a lot of those conditions and risks that were mentioned previously, such as liver cirrhosis and alcohol-induced cardiomyopathy, so all of these develop more quickly in women than men. And to add, females are also more vulnerable to alcohol's neurotoxic effects, which include things like brain shrinkage, as well as short-term memory impairment. And also because females have faster absorption rates and overall they have like predispositional and environmental differences from men, basically 1 drink a day for males is equivalent to, in effect, to 2 drinks a day for females. So that means drinking less alcohol consumption can pose greater overall risk for females than for men, even though they drink the same amount.
So understanding the process and the key players in alcohol detoxification can help to better understand the different implications of alcohol based on sex. So alcohol is detoxified mainly by alcohol dehydrogenase and aldehyde dehydrogenase in the liver. And upon injection of estradiol, a primary female hormone, into males, it was found that the activity of hepatic aldehyde dehydrogenase was increased. On the other hand, treatment with the testosterone called ALDH activity in females to decrease. And additionally, women, it was found that ADH activity was highest at ages 41 to 60 years compared to other ages, while in men, ADH activity was found to decline strictly with age. So although the exact mechanism for why women experience greater risks for alcohol is unclear, these differences in ALDH demonstrate how intrinsic hormone levels in females versus males can give rise to different ALDH isoforms, and therefore diverse activities and effectiveness. So it can provide evidence for sex-related differences.
And another interesting thing to touch on is the dopamine system in looking at the sex differences. So the dopamine receptor D2, DRD2, has been found to be different in males versus females. And this receptor is very important, especially in the development of addiction and alcoholism. And specifically, there's this allele called the A1 allele, and that is most important and very pivotal in the development of alcoholism. And carrying that allele means that there will be a decreased number of the dopamine receptors in the brain. And so research has found that girls with females with the A1 allele have been shown to seek increased novelty in their experiences compared to boys who have this allele. And so this personality trait kind of predisposes those women to substance abuse in adolescence, as they may seek like greater novelty and stimulation, and they may also experience decreased visuospatial ability and cognitive deficits, which is very interesting, and that in itself is a marker for substance abuse in adulthood. So knowing that like a female or girl has this allele can help predict their future relationships with alcohol, and it also goes to show how females they intrinsically kind of possess different mechanisms for dealing with alcohol, which is quite interesting.
Yep. So there's so many risks that are associated with alcohol consumption. And these are just some. And current guidelines for drinking allowance are only low risk. So, the guidelines that we have right now in terms of, drinking, they only dispose you to low risk. So that means no risk. If you're just under that limit, there's still low risk. So remember that no alcohol is the only way to have no risk.
Yep, and just as the previous slide, just as Dr. Curnew just mentioned, it's very important to remember that alcohol is a type 1 carcinogen, and so that can put someone at greater risk of developing all these horrible conditions like stroke, dementia, heart attack, or illness later in life. And after smoking, it's actually a very top cause for preventable cancer, among many other illnesses. And alcohol can also severely impact our overall health and the function of essential processes in our bodily system. And the more drinks that you consume, the more the alcohol will accumulate in your body and bloodstream and be distributed to your other organs. So as we keep mentioning, it's very important to remember that even a tiny sip can make a huge difference. And now we'll be describing a few impacts that might make you rethink the next drink that you have.
So type 1 carcinogen is not maybe, it is. Alcohol causes cancers. And that's something that we all know about tobacco. We all know about cyanide. Alcohol, unfortunately, is reached a higher category of evidence right now. Now, in all truths, is that dietary literature is mostly by association data, and so you make these associations, and there are some randomized data, and you're going to actually show us some randomized data in atrial fibrillation as well. So, and that's that's a very strong recommendation. And we'll talk about which type of cancers are associated with alcohol. Thank you. Can you tell us some more? I'm getting depressed here.
We're about to get a little bit more. So first of all, alcohol can negatively impact your immune system, like Dr. Curnew mentioned earlier. And in this day and age, your immune system is an aspect of your health that you for sure don't want to be affected, and you want to be healthy. So alcohol actually impairs our immune pathways, meaning it destroys your body's ability to fight infection and defend against harmful invading bacteria. So our white blood cells are the defenders, the frontline workers, if you might, of our bodies. And upon detection of an infection site, that's a little bit of biology, but a little bit of a biology class. But upon a detection of an infection site, a white blood cell army will assemble, and they'll travel through your bloodstream and engulf and destroy those intruders. So would you willingly kill off those frontline workers? I'm sure you wouldn't. Alcohol weakens this defense force and alters the production and the function of white blood cells. So it decreases that army and makes them less efficient. So ultimately, alcohol puts you at more risk for infection. And, like we said before, that's something that you don't want to happen.
And another thing that alcohol does is that it alters the concentration as well as function of very essential gut microbes in our gut microbiomes. So these microbes in our gut are microorganisms that assist gut function in doing things that are very important for our daily lives, like digestion and nutrient supply. And also they have a very big function in training our immune system. So having an imbalance in this gut bacteria would be linked to a very large number of health issues as well. And one example is an altered immune response. So gut microbes are able to order specialized immune cells to produce antiviral proteins that can provide that antiviral immunity which we need to fight off infections. And to think about kind of what alcohol does in this case is that it disrupts that communication between the microbes and our intestinal immune system. And what that does is that it sort of facilitates a very weak immune response as well as leakage of bacteria. And that can basically cause the progression of liver disease, which we will talk about more in detail later. And in terms of our digestive system, that can also inhibit the control and absorption of nutrients, and also that can lead to salivary gland damage, stomach ulcers, internal bleeding, gum disease, and a lot of other complications that we obviously want to avoid.
Yeah, so we want to touch on all aspects of how alcohol can impact your health, and in some ways you might not have thought about. So for men, a common side effect of alcohol abuse is actually erectile dysfunction. And for women, alcohol abuse can lead to menstrual and reproductive disorders such as irregular menstrual cycles and infertility. And we want to mention here, although this might not impact your health particularly, but for people or individuals that are pregnant, alcohol consumption can result in miscarriage, stillbirth, and a range of fetal alcohol spectrum disorders. So your decision can impact the physical, facial, and mental development of a child. So that's just something we wanted to add.
Yeah, and moving on to how alcohol can also impact our brain and central nervous system. So alcohol is classified as a central nervous system depressant, and that means that when it's consumed in very small amounts, it actually interferes with the frequency of neurotransmitters that are responsible for things like neuron-to-neuron communication or communication between nerve cells. And what that does is that it can result in decreased brain activity, which of course is not a good thing. And alcohol also destroys our brain cells and damages our brain tissues. And overall, that can result in a lot of neurotransmitter cognitive deficits. So some of the most notable effects that we notice in these deficits would include things like impaired vision and memory, slurred speech, and also being unable to think logically.
So some of those short-term effects of alcohol in the nervous system are described as alcohol
Next
poisoning.
slide.
This one, yeah.
Yeah.
Alcohol poisoning, which can include symptoms such as irregular breathing, irregular heartbeat, disrupted normal heart function, dehydration, and vomiting. But long-term heavy drinking can also lead to the development of a condition called alcoholic neuropathy or nerve damage. So symptoms include pain and numbness sensations throughout the body, and as well as this chronic muscle spasms and cramping as well.
So now we'll be moving on to explain a bit more about how our cardiovascular system, as it's so important, is very negatively impacted by drinking. So for heart rate, as you may already know, that refers to the number of heartbeats that you get per minute. So our heart rate can really increase after drinking alcohol for a number of reasons, and these include things like alcohol intolerance, which is a reaction to alcohol, but also because of increased stress on your heart in general. So in some cases, alcohol can act as a vasodilator, and the initial intoxication can cause our blood vessels to dilate or become sort of enlarged, causing the heart to pump harder and faster. And some previous studies have linked heavy binge drinking to episodes of tachycardia or increased heart rate. So regular episodes of tachycardia are also linked to higher risk of things like blood clots and heart attack and stroke as a result of those blood clots.
So another aspect of cardiovascular health that drinking affects is blood pressure. So while drinking more than 3 drinks in one sitting can lead to short-term blood pressure increases, heavy binge drinking can lead to long-term increases in blood pressure. So we talked a little bit about that initial intoxication that causes the blood vessels to dilate. So at even higher levels of intoxication, alcohol will act as a vasoconstrictor, meaning that it causes the blood vessels to get narrower, and hence the heart has to work again harder to pump and circulate blood. And this causes an increase in blood pressure.
And also, one other bad thing about alcohol is that consuming it in high amounts can lead to the weakening of muscles. And that becomes very complicated and bad when it concerns our heart muscles. So alcoholic cardiomyopathy is a condition that can occur after long-term binge drinking, and that is when the alcohol has damaged your heart and also caused it to change shape because it stretches the heart muscles and causes it to enlarge. So once again, this would really weaken your heart and cause it to be unable to pump blood as efficiently as before, and this can ultimately lead to heart failure, which is essential to be avoided.
So alcohol is actually associated with atrial fibrillation, as Dr. Curnew mentioned before, and adverse atrial remodeling, which constitutes any change in atrial structure or function that promotes arrhythmias or regular heartbeats. So it's also been found that moderate drinkers develop larger mean left atrial sizes over time. And an example being shown by a left atrium that is 28 centimeters squared versus 22.7 centimeters squared in non-drinkers. Furthermore, moderate drinkers had much slower conduction velocities and a higher proportion of complex atrial potentials. So in the study, it's indicative of worsened cardiac health. So it can be seen that improving lifestyle and alcohol habits would be pivotal to combating atrial fibrillation. And Dr. Curnew, did you want to mention anything?
Yeah, so one of the things is that you're showing in basically in the lab some data is that one of the things that predicts atrial fibrillation when we do an ultrasound is your size of your left atrium. So if your left atrium is enlarged, it means you're more likely to have atrial fibrillation. So you've shown that people who drink have a bigger left atrium. The heart's electrical, and you've shown that people who drink have different electrical properties in their heart that can actually increase atrial fibrillation and also PVCs as well. But so here's some laboratory data that's very suggestive effects of alcohol, which you're going to show us in a second is even more top A information. So keep telling us more.
Yeah, for sure. And just to provide like a better idea or like a better idea of the effect of alcohol on atrial fibrillation occurrence, it can be seen by the study that was conducted with 140 patients, and these patients were randomized to either abstinence or control groups. And then after a 2-week period, their occurrence of atrial fibrillation was recorded and assessed. So what this study found was that atrial fibrillation, it recurred in 53% of those participants in the abstinence group, meaning that those people didn't drink alcohol during 2 weeks, and 73% in the control group who kept on drinking alcohol. So this is a very significant difference, and it provides evidence for the claim that abstaining from alcohol really helps to reduce arrhythmia in regular drinkers with atrial fibrillation. And this statistic was also maintained even during the 6-month follow-up assessment. So it shows also that abstaining from alcohol doesn't only have short-term effects, but also can be very beneficial in the long run.
So this to me is the highest quality information. So they took this done in Australia. They took patients who had intermittent atrial fibrillation. So your atrial fibrillation can be there all the time, permanent atrial fibrillation, chronic atrial fibrillation, or it could be intermittent. And most atrial fibrillation starts off intermittently. And I remind people that who feel their atrial fibrillation, 90% of episodes of atrial fibrillation, you actually don't feel them all. So that's why we use monitors to detect this. And so these were people that had intermittent atrial fibrillation, were randomized. And so to get into the study, you had to have about 15 drinks a week or so. And you're asked not to drink or to continue drinking. Now, those that were in the non-drinkers, they actually reduced their alcohol consumption by half. So they still were drinking, but half the amount compared to their usual 14, 15 drinks a week. And it showed that roughly a third of atrial fibrillation was eliminated by alcohol. Now, alcohol is not the sole source of atrial fibrillation. Is that as we get older, atrial fibrillation becomes more common. It's a big source of stroke, dementia, Alzheimer's disease, and having atrial fibrillation is double your risk of stroke and doubles your overall having atrial fibrillation increases your risk of stroke by about 7-fold. It doubles your mortality. So atrial fibrillation is can be reduced by of course dealing with alcohol. Other things to do is losing weight, controlling blood pressure. But you can see that wow, a third of atrial fibrillation was actually reduced by not drinking. So that's very important information. This is randomized. It wasn't this is people were asked to do something. So tell us a little bit more.
Yep. So drinking alcohol is also heavily related to the incidence of stroke, both ischemic and hemorrhagic. So ischemic stroke is due to the lack of blood supply to the part of the brain, which prevents adequate oxygenation, whereas hemorrhagic strokes is due to blood loss. So this is partly tied with the incidence of atrial fibrillation, which was mentioned previously, as having atrial fibrillation increases one's risk of stroke by 5 times, and it can cause blood clots to form in the heart. So these arrhythmias can promote thrombus formation and propagate already existing thrombi from the heart to other places like the brain. And also, since drinking alcohol has a clear relationship with high blood pressure, as we described before, over time, hypertension puts strain on the heart muscles, and that also subsequently increases the risk of heart attack. So we kind of talked a little bit about how drinking alcohol is really impacting every aspect of your heart, from heart rate to blood pressure to muscles. It's impacting every aspect of function, and all these are intertwined. So, like Dr. Curnew mentioned, none of this, everything's comorbid. So it's affecting all parts of your heart and other parts of your body. And we're going to get into a little bit more now that we discussed a little bit about the heart, how it impacts another essential organ in the body.
Yep, so now that we've gotten one of our most important organs, obviously the heart, out of the way, we'll kind of be touching on how alcohol is also heavily associated with risks for the liver and causes diseases of the liver. So in 2016, it was actually found that among 33,000 liver transplant patients since 2002, 36.7% of these patients had alcoholic liver disease. So that is liver disease that is induced by alcohol. And from this data, it can really be seen again how heavily implicated alcohol is in liver health and how important it is to limit alcohol consumption. So also approximately 1 in 5 heavy drinkers were seen to develop scarring in their livers, which is also known as the cirrhosis that was mentioned previously. And what this does is that it causes scar tissue to build up in the liver, and it can ultimately lead to liver death and can require a transplant. And so yet, this is another reason why alcohol should be limited whenever possible.
So we already established that alcohol is the number one, is a carcinogen, is a type 1 carcinogen. So the impact of alcohol on cancers appears to be relatively understudied and unknown. However, it should not be ignored, as we know that it is a type 1 carcinogen. So as 4% of new cancer cases worldwide in 2020 were actually attributed to alcohol abuse. So moderate drinking accounted for around 14% of these projected annual cases, revealing that regardless of the level of alcohol, drinking in itself always increases the risk of cancer. So it's not just binge drinking, it's moderate drinking, it's light drinking. These are all impacting and increasing your risk of developing different diseases, just like cancer. And particularly, alcohol is commonly linked with cancers of the oral cavity, of the pharynx, of the larynx, esophagus and colon, rectum, liver, and breast in females. And that's stressed that it is related or linked to an increased risk of breast cancer in females specifically.
So it's not to just all cancers. These are like ones that line the gastrointestinal system. Breast is a big one. And we all knew about liver, but this is actually expanded what we learn right now. And so I'm not saying alcohol is the cause of cancer, but we're learning about cancer is that the risk factors like high cholesterol is associated with cancer, high blood pressure is associated with cancer. I'm going to tell you something I think is remarkable is that when I first started practice, if you took 10 people who had a heart attack or a bypass, 8 would die from heart disease. Now the number is 3 will die from heart disease and 4 will die from cancer. So cancer has become a bigger problem, and as we live longer, we have better treatments for heart disease. One in particular is losing weight, exercising, not smoking, know your cholesterol, statin therapy. Bypass surgery has played a role, but it's not as big a role as we first thought it would be. It's all those preventive things, and we're learning one way to think about many cancers is think about prevention. You start at the beginning saying that it affects the brain, and one of the things is that as we get older, Alzheimer's disease or dementia becomes an increasing problem, but and alcohol is one of those factors that makes this process worse. So think about what you can do to keep yourself healthy for as long as you can. Boy, you're really shedding a lot of information. Thank you. Tell us more. I think.
Yeah, definitely. It's very interesting because alcohol um accounts for like a lot of cancers, but it's also a very preventable thing. So I think it's good that this is kind of coming more into the spotlight now. And now that we like kind of saw the most common cancers that are linked with alcohol, we can kind of take a look at how that distribution falls in percentages. So alcohol has actually been found to be accountable for more than 45% of oral cavity or pharyngeal cancers, more than 25% of laryngeal cancers, 12.1% of female breast cancers, 11.1% of colorectal cancers, as well as 10.5% of liver cancers. So as Dr. Curnew mentioned, these are all like mostly affecting parts of the GI tract, which is quite interesting. And as can be seen, the fact that alcohol has been accountable for like half of pharyngeal and oral cavity cancers is very interesting and shows how important alcohol is in its implications for cancer and how important it is to prevent cancer through alcohol.
So this is a quote that kind of mentions, or it's from the Rumge of the International Agency for Research on Cancer. And it basically states that low and moderate levels of drinking, so we kind of established 1 or 2 alcoholic drinks a day, contributed relatively to more cancer cases among women than amongst men. So we've kind of been discussing, the difference in relative risk between men and women. So once again, this shows just how women are more vulnerable to the lasting health impacts of alcohol. And for both mild and heavy drinkers, it was found that reducing their drinking levels or abstaining helped reduce the incidence of cancer. So this clearly indicates that alcohol cessation and reduction are effective and essential remedies for cancer prevention. So while it's not, like Dr. Curnew said, it's not really the cause that's we're certain of, but it is shown to be, alcohol reduction is shown to be a preventative measure that should be considered and accounted for in at-risk in any individual.
Okay, so now that we've taken a look at how alcohol really poses risks to a variety of our organs and health, now we're kind of going to be taking a look at the common perceptions about alcohol, and namely that light or moderate levels of drinking are helpful to health, and then debunking those common perceptions and telling you the truth. So one thing we want to ask anyone watching is if you are guilty of drinking a glass of red wine at dinner and telling yourself that this is healthy. So we know that a lot of people mistake red wine as an antioxidant component or polyphenol, which is found in red wines, known as resveratrol, as a significant health benefit of wine. And while studies have shown that resveratrol can help prevent damage to blood vessels by reducing low density lipoprotein, which is bad cholesterol, and preventing blood clots, we know that these findings are very mixed and kind of uncertain. So basically, resveratrol in red wine comes from the skin in grapes. And so eating grapes or unfermented grape juice is a very healthy alternative to experience its health properties without actually consuming red wine, which is an alcohol and not good as it seems.
And I just want to add that to even experience any benefit from drinking red wine in terms of the antioxidant properties, you have to drink an excessive amount, and it's just unrealistic. And the cons that we've discussed already significantly outweigh any pros that you would get from drinking excessive amounts of red wine just for an antioxidant property. So it's thought that the light to moderate alcohol consumption has cardioprotective value, often represented as a J-shaped curve. As seen on this J-shaped curve on the slide, it can appear like moderate drinking is associated with lower mortality than no drinking or light drinking. But it's important to notice that the simplicity of the J-shaped curve is deceiving. There's genetic and lifestyle factors that are often left out of this picture when determining alcohol consumption. So these factors could be responsible for their risk of mortality, separate from the amount of alcohol that they consume. So it's not representative of other factors, and hence is a common misconception. So therefore, this current interpretation of the J-shaped curve may actually be a little bit biased and misleading to an extent, as another potential bias is including non-drinkers as a reference group, even though they might not drink for reasons like poor health. So this is definitely something that shouldn't be referenced, and we can definitely debunk.
So another thing we kind of want to touch on is that sort of recent alcohol guidance until recently recommended to drink less than 14 units a week, which we kind of touched on at the beginning too. And for participants who follow those guidelines, it was found that their risk of experiencing cardiovascular events was increased by 23% for each additional 1.5 pints of 4% strength beer. So this basically shows that even a very seemingly minor amount of low strength alcohol could actually have a very detrimental effect on these people's health. And even those who consume less than those 14 units had very elevated risks of being hospitalized because of cardiovascular events. So knowing this information, you might be kind of wondering, then what is the recommended alcohol dosage? And although we've been mentioning a couple times throughout this webinar, we just want to mention again that the recommended alcohol dosage is no drinks at all. So it's very important to recognize that even small amounts of alcohol can increase your risk of cardiovascular disease very unexpectedly. And also, we know that having no drinks is definitely not an easy task, but in the end, given all this information we've been presenting, you should keep in mind that that is the healthiest option if possible.
So this is a questionnaire that we just wanted to add. It's called the CAGE Questionnaire, and it's a testing tool used to assess potential for alcohol drinking problems or abuse in an individual. So there's 4 questions there. The first one's the C. So have you ever felt that you should cut down your drinking? The A, have people annoyed you by criticizing your drinking? The G, have you ever felt guilty about drinking? And then the E, have you ever had a morning eye opener, the first thing in the morning after to steady your nerves or get over a hangover? So a score of 2 or greater, or at least 2 yes responses to one of these questions, to the 4 of these questions, raises concern for the potential presence of alcoholism or alcohol abuse. And that calls for further investigation. And we just want to highlight that that final question regarding an eye opener, so that refers to a drink first thing in the morning. And a drink first thing in the morning is a sign of alcohol dependence. So that's definitely something that if you have checked off is a high indicator of presence of alcoholism and should be addressed immediately.
So this is actually kind of just if you just backtrack one slide, if you just backtrack, so I find that people are very set in their ways, and you know, I'll give you an example. My ethnic background, saying I should, you know, be drinking. It's always been part of my culture, and it is part of many people's culture, but unfortunately, it's not part of healthy culture. The question that really rings out to me is that if someone talks to you about alcohol and you're getting annoyed about it, you probably drink too much. If someone's expressing concern about your health and you're getting upset about it, that's a worrisome trait. I think, you know, the eye opener I've had first thing in the morning, I think people understand that. You know, you're dependent on alcohol, you have to have alcohol, or you get shakes and jittery, or you might have withdrawal seizures. When people around you are worried about your drinking, and you feel that, chances are you drink too much. Now, one of the things that what we learned is that there's no safe amount of alcohol, but we all do things that are unsafe, and none of us are perfect. And so you have to but you have to come in walking and thinking that if you think there's a health benefit of alcohol, I can't find one anymore, unfortunately. And you saw what the science is telling us. So tell us more. Keep going.
So this actually is going to bring us to the end of all the information we have prepared. And what we want you to take away from this presentation is that alcohol is never an answer. And we really hope that this presentation has sort of exposed you to some of the risks that are associated with drinking and that you've gained some new insight. And this is by no means meant to preach or put someone down, but rather to discuss a very real problem, which is drinking alcohol. And being educated and knowing the risks of drinking alcohol are very key. And just as you read a list of side effects before starting a medication, we think it's very important to know just exactly what a sip of alcohol a day can do to your health today tomorrow, and also in 10 years from now. So if after listening to this presentation, you recognize that you may have an alcohol problem or have been sort of unnecessarily exposing yourself to health risks by drinking and you want to quit, we invite you to check out some of the resources that we will be adding into the description, as well as our past webinar on this channel, which is called Let's Talk About Drinking. And we have also linked it here. And so this webinar also goes into more detail about seeking support and understanding sort of whether you have an alcohol issue if you're not sure or kind of uncertain at this point in time. So we also encourage you to reach out to your primary care physician if this is a decision that you wish to make. So yeah, and no matter how severe or non-severe the problem may be, we want to let you know that all individuals can benefit from intervention and treatment.
So that's the end of our slide, our presentation. So if you have any questions, please reach out to us at our email here. And like we said before, check out our YouTube. I'm not sure if the slide's there, but that other video, or there it is, it's the Let's Talk about alcohol consumption and awareness video. That one has, it might be a little long, but it's got some really good information that if this is something you're interested in doing and quitting alcohol, could be a video that you can check out to help guide you in that journey. So thank you so much. And we'll pass it off to Dr. Curnew now.
And there was another video we did a couple weeks ago about coffee and alcohol as well. So I got this ball in front of me, and I got my glass from Newfoundland. I have Newfie background, and Screech is something that's been popular in Newfoundland. And so what can I do differently? Well, this is actually kombucha. So this is fermented tea. And so so I'm trying to change as many behaviors as I can. And I know after the age of 20 to 30, our body starts to decay. So, you can lose 50% of your muscle mass by the age of 70. We're losing brain cells on a regular basis, but we can form new neuron connections and things of that nature. Now, I'm not saying you should not drink, but alcohol has very pleasurable things. It's very social for people, and people feel it helps put them to sleep. But if you use alcohol to put you to sleep, it will put you to sleep, but it won't put you to sleep for very long. You have bad quality sleep, and you'll wake up for that. If you're using it to calm your nerves and treat your stress and anxiety, I think there are better approaches. And I'm certainly far from perfect. I think 0 to 2 drinks a week is something people can think about as being part of a healthy lifestyle. I do know if you have atrial fibrillation, any alcohol can make this worse. One problem I see is people with high triglycerides, very high triglycerides. All the white foods, white sugar, white flour, can all contribute to your triglyceride as well as alcohol consumption. So those are people I feel more strongly about no alcohol. If you have a triglyceride greater than 5, alcohol will make that worse. And so, is that, sugar, having pop and white sugar, white flour, white rice, white bread, these are all unhealthy foods that we all aware of, and alcohol is now part of that equation. So I think if you sort of think about, this is that if you drink, maybe I'll just drink a little bit less. Maybe I won't drink at all. But it's not meant to be judgmental anyway. It's just showing how science has evolved over time. And so I'm going to have some kombucha, no more Screech for me. And I will have a drink or two on different celebrations, but I will not drink on a regular basis at this point in time. And you decide what's best for yourself. But don't pretend that alcohol is a health food. It's not. You see, you've seen with what we've learned along the way, and science, and hope you learn to apply that best to yourselves. Daniel, what do you think?
No, it was honestly a very good webinar, but there was one statistic that I wanted to share. I was reading about this earlier in the day. I think it was the CDC in the States put out this statistic. Over the past two decades, the sort of percentage of alcohol in attributable deaths has gone up by 7% every single year, except for when COVID hit in 2020. it increased by, I think, 36%, which was actually the highest increase over the last 40 decades. So alcohol has been a big problem for a long time, but even more so, I think just the COVID has really just the health the health negatives of alcohol has never really changed, but it's been more integrated, I think, in our daily lives since COVID has hit. So it's even more important now to sort of talk about these kinds of things and increase awareness about all the negative sort of health detriments that alcohol brings. And I think it's just something to think about.
Yeah, it's important. You know, I think people know that, you know, liquid calories contribute to weight gain, and alcohol is rich in calories. We all knew about, you know, the car accidents and the friends that have lost their lives from liver cirrhosis. But I think we broadened that approach. It wasn't good for pregnant women, and it's certainly not good for the rest of us. And so maybe I would have a few more IQ points if my mom didn't have that drink when we were pregnant, but she didn't know any better. Now we know better. And so thank you so much for sharing this information. Any thoughts from anybody else, and any questions or comments? I want to thank these two lovely ladies for doing the research and doing their homework and sharing that with us, and that was done so well. Thank you.
Thank you. I'll just add on that, like, for anyone who might find themselves like dependent on alcohol at any point in time, and especially in the morning, like Dr. Curnew mentioned, kombucha is a very healthy alternative, and it has a lot of health benefits that are very like subtle but definitely there. Like, it can really help with digestion and kind of like getting rid of like toxins in your body, and overall it can like boost your immune system if you keep having it over time too. So that's a good alternative, as well as things like sparkling water. These can be very good as well. Like maybe the bubbly taste, a lot of people who like that, they can find themselves drinking that more instead of alcohol, and it's very like calorie free options are available as well. So there's like a lot of diverse options to try other than alcohol, and we think it's important to notice that too.
And at the end of the day, there's always water too.
Yeah.
Well, listen, I'm going to bid everybody good night, and something that people need to ponder and think about how to be the healthiest version of yourself. And we're all a work in progress. So thank you so much. Good night, everybody.
Good night,
Good
everyone.
night.
Thank you.
Thank you.